Nebraska for purposes of an opening statement.
Thank you, Mr. Chairman. Today we are here to mark up the Increasing Opportunity and Success for Children and Parents Through Evidence-Based Home Visiting Act to reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program known as MIECHV. This program helps support state and local efforts to provide voluntary, evidence-based, outcome-focused home visiting services to parents and children living in communities that put them at risk of poor social and health outcomes. The program's objectives include promoting school readiness for young children, increasing economic self-sufficiency of families, improving prenatal health and birth outcomes, and preventing child abuse and neglect. I, like other members of this subcommittee and committee, have had the opportunity to see firsthand what home visiting looks like in our communities. In March, I spent time with the Panhandle Public Health District's Healthy Families America program, which aims to improve the economic success and school readiness of vulnerable children and families in 3 Nebraska counties, Scottsbluff, Morrill, and Box Butte counties. Dawn, one participant I met with, shared her experience of working with a home visitor who helped her find a stable home and a steady income in order to provide for her growing family. These are the types of outcomes we should be expecting and receiving from the use of limited taxpayer resources. MIECHV is one of the only social programs where funding is tied to proven evidence. Unfortunately, MIECHV is an exception to how we often fund programs, as few federal social programs have been evaluated to determine if they are working, and almost none tie the receipt of funding to evidence of effectiveness. In the Better Way agenda put forward by House Republicans last year, we proposed doing more of what MIECHV does: measure how well programs are working to focus funding on programs which produce real results. When we spend limited taxpayer dollars to help those in need, we must make sure we're spending money on effective programs. To do otherwise is a disservice to both taxpayers as well as those who are seeking to help. On March 15th of this year, the Human Resources Subcommittee held a hearing on MIECHV. 2 of our witnesses, Beth Russell and Rosa Valentine, shared their experiences working together through the Nurse Family Partnership Program in Lancaster, Pennsylvania, a home visiting program supported by the program. Rosa was 14 years old when she found out she was pregnant and was unsure how she would be able to take care of her baby while also achieving her education goals. Her nurse, Beth, helped her have a healthy pregnancy, cope with stress, and become a confident mother. By using the evidence-based nurse-family partnership model, Beth successfully helped Rosa through her pregnancy and continues to guide her through her first 2 years of motherhood. Today, Rosa is a 16-year-old junior in high school, is on track to graduate next year, and is a loving mother to a healthy 20-month-old daughter. Both before and after the hearing, we sought input from states and others about how the program was working and how it could be improved and strengthened. The result of these conversations is the bill before us today, which would, number 1, continue the program at the current law level of $400 million per year for 5 years. Number 2, make sure states continue to achieve results. 3, require states to periodically reassess needs across the state to focus on high-risk communities. Number 4, allow states to fund home visiting services on a pay-for-outcome basis. And finally, strengthen partnerships between the federal government and state, local, and private organizations by requiring a dollar-for-dollar match by FY 2022, mobilizing more resources to serve families in need. There is broad bipartisan support for MIECHV, including dozens of national organizations and hundreds of state and local organizations, ranging from business leaders, law enforcement officers, faith-based groups, healthcare providers, child welfare advocacy organizations, and early education providers. While I understand some of my colleagues would like to continue this program or even increase spending on the program without paying for it, our current deficit means it would be irresponsible to continue to fund programs without finding ways to reasonably reduce spending elsewhere. I'm grateful for the time we are spending today to mark up this important bill, and I look forward to moving forward so we can ensure this program continues in the years ahead. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Smith.